Good morning. This is Meditation, Medications, your first psychiatric consultation, page 12 through 16. The rise and fall of physiologic reserve from conception to death. The patient, psychiatrist, primary physician, and attorney should understand that the physiologic reserves rise from the point of conception and decline starting in the fourth decade of life or earlier. Women should start birth control before they start psychotropic medications because psychotropic medications can cause birth defects. Women should not restart psychotropic medications until after they stop breastfeeding and after birth control is restarted. This will prevent birth defects, addiction, and other adverse effects on the fetus and newborn child. If the patient insists on taking medications without birth control and while pregnant and breastfeeding, they are accepting a substantial risk of birth defects, addiction, and other adverse effects on the fetus and newborn child. Many physicians will not prescribe psychotropic medications under these circumstances. When there are flu epidemics, the very young and the very old are most likely to die, and most adolescents and adults do not die because of the low physiologic reserves in the very young and the very old. Because of low physiologic reserves, most psychotropic medications are not released by the Food and Drug Administration for the very young. They are used off-label by pediatric psychiatrists because experiments on children are not allowed before the release of the medications. The off-label use in the very young is basically an experimental use without a control, ethics committee, or other constraints required by the Food and Drug Administration before a medication is allowed to be marketed to the public. There are black box warnings about sudden death in the elderly demented patients exposed to antipsychotic medications. This is a rather narrow warning. There is no scientific basis to assume that demented elderly patients have lower physiologic reserves than non-demented elderly patients. Risk assessment and do no harm compels a physician not to prescribe antipsychotics to the elderly regardless of whether they are demented or not. The black box warning regarding sudden death in demented patients was more likely written by an attorney than by a physician. The package inserts for most psychotropic medications have hundreds of side effects listed. It is not likely that a psychiatric patient will have a full understanding of a psychotropic medication with a single review. I encourage patients to read the package insert and bring it to the office for as many visits as necessary for the patient to feel that they understand the risk and benefits of taking the medications for the long term. The literature on antipsychotic medications is that after the first psychotic episode, there are likely to be many patients who can do well without any medication or with low doses of medications. The decision to continue without medication or with low dose of medication remains the patient's decision. The decision to use high doses of antipsychotic medication should also be the patient's decision. Given the information above, the patient and his attorney might ask what and who is being treated when the D2 saturation is raised above 65% and Haldol is given at doses above 3 milligrams a day, or Thorazine is prescribed above 150 milligrams a day. The best practice at this time is the low dose antipsychotic medication with D2 saturation at 65% and below, 72% a prolactin monitor, and with an offer of a medication reduction and taper with each visit. That, of course, would be the patient's view and what his attorney would advocate. Thank you for your time and kindness. Have a great day. Tomorrow we will discuss the number to treat or the number needed to treat. Have a great day.